Hi ladies and gentlemen, back again, Bathrobe Chronicles number 175. And frankly, I'm sitting here, I have one that I'm planning on doing in a couple of minutes, but for whatever reason, I've been trying to dream up these other ones right on the spot, so I'm not sure if this is going to make the cut or not, so to speak. But, and maybe I have, on some previous ones, excuse me, I've alluded to this or talked about it briefly. What I'd like to talk about is whether or not we create mental illness. Now, what am I trying to say here? I had mentioned a few segments ago that almost everything that happens out there, if there's police involved or what have you, we oftentimes say, oh, we're going to evaluate the person. In other words, we want to determine if this person has a mental illness and how that would influence what the court will do or what have you. But I think on a more basic level, and maybe what I'm saying is has no merit, and hey, you know, that's fine if that's what you think, and maybe it doesn't have any merit. But anyway, I think oftentimes what we do is our approach to people sort of creates, what's the word I'm groping for here, a dependence on counselors and psychiatrists and psychiatric hospitals, treatment centers, and on and on and on. What do I mean by that? Okay, let's just say you're having a bad day. Let's say you're a regular person, whatever that means. And let's say something horrible has happened in your life. You know, let's say you're 30, 35, 25, 45, 50, whatever. You've never been in a psychiatric hospital, you've never seen a psychiatrist, you've never been on any kind of psych meds or anything else. But let's say something really bad happens. Maybe death of a loved one, maybe you lost a job that you had had for 20 or 30 years, a relationship ends, or you end up going bankrupt or whatever. Any of these kind of events, these, you know, truly tragic events. And let's just say someone says to you, which normally we do, oh gosh, why don't you go see a counselor? Okay. Can counselors help people? Of course they can. Can counselors hurt people? Yes, they can. What do I mean by that? The whole idea of counseling is to not have counseling. Okay, George, that sounds like double talk. No, it's really not. The whole idea is if I'm having a problem and I feel as though I need a counselor, and let's say a counselor can help me with this problem, then in my opinion, it's a counselor's job to get me in and out in a hurry. Now, if a counselor gets me in and out in a hurry, then the counselor has lost a customer, a patient, or whatever term you want to use. So there's some incentive for a counselor, you know, to keep you coming back. Do counselors do that? As a rule, I doubt it. Are there some counselors who do that? Of course there are. Because as long as you keep coming back, they keep making money. So this is sort of one aspect of it, the keeping people coming back. We're sort of creating a mental illness here, if you will. On the example, let's just say something horrible happened to this person and they're having trouble dealing with it. You know, you might say it might be reasonable to go see a counselor. And ideally, one thing a counselor should have is they should be disinterested. In other words, they aren't a family relative who you're talking to, they aren't a loved one, they aren't your best buddy. These people may not be able to be but so objective in trying to help you. The other job of a counselor is not, well, with some exceptions, of course, is not to solve your problem for you. It's to help you solve your problem, to help you come up with your options and what you can do to help yourself to feel better, to make yourself feel better, or whatever. So the part about creating mental illness is creating a dependency, if you will, on going to a counselor. And you can be dependent real easily on a counselor. In other words, you can look forward to those sessions, in other words, every week, because you are going to get something out of it, whether it's something beneficial that ultimately will help you I don't know. You know, sometimes yes, but oftentimes if you've been in counseling for 99 years, like a lot of folks out there, you ain't doing anything other than, you know, becoming mentally ill or verifying or there's a word I can't come up with here. Uh, and you're going to become part of the mentally ill, you know. The other thing that happens oftentimes is that someone has some kind of tragic event, and the first answer to it is, oh, go to a psych hospital. Ladies and gentlemen, you really need to stay away from the psych hospitals. You truly do. Um, what kind of people actually need to go to a psych hospital? I'd say off the top of my head, most likely, let's say 3 kinds of people, or people who are, uh, well, anyway, one. Let's say you have a seriously mentally ill person, someone who has a psychotic illness, you know, schizophrenic person or something like that. Let's say they get off of their meds, as they say, and they no longer know reality, and they're acting in such ways that puts themselves out there to be harmed, or they are no longer really able to function. And the way that they're going to get back able to function is to get back on their medication and get stable, as it's said. Okay, that's one person who needs to go to a psychiatric hospital. Another person who needs to go to a psychiatric hospital, although how much this is going to help, I don't know, is if someone is seriously considering killing themselves. I mean, in other words, you know, for whatever reason, they're to that point and they're considering this. Now, I'm not talking about all the ones who say, oh, I'm going to kill myself because they want to be in a psychiatric hospital. I'm talking about the handful of people who are going to kill themselves, who have intent, who have a means, and somehow someone finds out. Those people might benefit, you know, as I said, might. And who are the third category? The third category would be a person who basically is no longer able to function because they're so severely depressed. Now, this might be a person who has stopped bathing, who stopped eating, who stopped sleeping, who's never sleeping, who's not paying their bills, and basically is no longer able to function. That's the 3 types of people who might benefit from inpatient hospitalization. The rest of us were whistling Dixie, ladies and gentlemen. I used to somewhat jokingly say, but I actually mean it, is if you're extremely depressed over some horrible thing that's happened in your life, you would be far better off checking into a nice motel, going for walks, getting some exercise, and eating nice meals and sort of bailing out that way for a few days. I think you would benefit far more than if you were in a psychiatric hospital. What happens in a psychiatric hospital? Well, there's no miracles in there. You can't go in there and get fixed. They just are not going to fix you. They're not going to change your situation in your environment at all. So if you're a regular kind of person who's having some emotional problems or whatever, mental problems, or who's had some horrible trauma or something, you most likely are not going to be helped. The other thing we do, I think, to create mentally ill people in its loosest sense is the answer to everything is medication. Hey, I'm having a bad day. Oh my gosh. And boy, here comes the script for Prozac or, all the other ones, all those antidepressants. Paxil, on and on and on. And that's the first thing that we do, or society does, or whatever, is we write a script. Is this going to help you? Hey, I don't know. If you're depressed because of a situational situation, I doubt if it's going to help you at all. It's not going to change your environment. It's not going to help you, with some exceptions, make better choices in your life. And most of the time when we're depressed, it's something situational. It's something in our environment that for whatever reason we aren't dealing with. And I don't see how going into a psychiatric hospital is going to help you deal with it. I truly don't. The other thing we use routinely is rehab. If somebody, has a DUI or something, or they get caught with, an ounce of pot or what have you, then the answer seems to be rehab. Everybody needs to go to rehab. is rehab going to help you? It's going to help some folks, I'm sure. But do we all need to go to rehab because we did something stupid one night? Doubtful. Uh, and that most likely isn't going to stop us from continuing to do stupid things either. But as I said, sometimes the rehab thing, if you have a problem controlling your drinking or marijuana or whatever, crack, this, that, and the other, I'm not saying you shouldn't go to rehab. What I'm trying to say is, for most folks, it's not going to fix the problem. Uh, it might be nice to get off the streets for a couple of days and sit back and think about things, but other than that, I don't see a whole lot of benefit. I really don't. That might actually be a time when you might want to talk to a counselor, and to see a counselor maybe one or 2 days a week for a few weeks to see if you can come to grips with this behavior that's not helping you, that's causing problems in your life. But anyway, I think the main thing that any of us want to try to avoid, or should try to avoid, is becoming mentally ill. You know what I mean? In other words, let's not become a victim, which a lot of us do. Oh, I've had a horrible thing happen to me, and I just don't know what to do. And we have that happen to us. We just don't know what to do. We're frantic. Nothing we're doing is working. We try and drink a little more, it doesn't go away. We try and use some drugs, it doesn't go away, and all of that. Then we might end up seeing a counselor or whatever. Now, the counselor can help you, but don't start identifying yourself as a victim. In other words, oh, poor me, look what happened to me, everything is horrible, and start sucking up the drugs and going to the therapist. And I've met people who've been going to therapy 15 or 20 years. Come on, give me a break, will you? This is what happens. I'm not sure if any of this made any sense, and that if any of you will agree with any of it. But if nothing more, food for thought, as they say. And as Pat Condell would say, peace, ladies and gentlemen, peace. And watch those psychiatric hospitals and those darn counselors and those crazy rehab places. Good night.